How do you cope with variants of unknown significance in lymphoma genetic testing? Imagine getting a genetic test result that shows a change in your DNA, but no one is quite sure what it means. That's what a variant of unknown significance is. It's a genetic alteration found during lymphoma testing that scientists haven't yet linked to increased risk or specific behavior of the disease. This can feel confusing or even unsettling, but understanding what it really means helps you manage it better. First, it's important to realize that a VUS does not mean your genetic change is harmful or harmless. It simply means we don't have enough information yet. It's like finding a puzzle piece that might fit, but we're not sure where. This uncertainty means that the VUS should not be used to make immediate decisions about your treatment or preventive measures. Instead, doctors recommend sticking to standard lymphoma diagnosis and treatment plans based on your symptoms, biopsy results, and imaging studies. Staying in close contact with your healthcare team is key. Your oncologist or genetic counselor can help interpret the VUS in the context of your overall health. They keep an eye on new research and updates in genetic databases that might reclassify the variant later. Sometimes, testing family members can help clarify whether the genetic change runs in the family and might be linked to disease. However, this process can take time and may not always be feasible. Functional studies, which test how the variant affects cell behavior, are also helpful but are usually limited to research settings and not routine clinical practice. It's also important to stay informed about any reclassification of the VUS. As scientists gather more data, a VUS can be reclassified as either benign, meaning it's not a concern, or pathogenic, meaning it could be linked to disease. Your healthcare team will typically monitor these updates and inform you if your variant status changes. Dealing with uncertainty can be stressful, so seeking support from counseling services or support groups can be very helpful. Talking about your feelings and concerns with others who understand can ease anxiety and help you process the situation. Clear communication from your medical team about what the VUS means and what it doesn't mean can also reduce confusion and help you focus on what's most important, your overall health and well-being. Remember that genetic testing is just one part of a comprehensive diagnostic process. It complements traditional methods like biopsies, imaging, and clinical exams. Treatment decisions should always be based on the full picture, not just a genetic result that is still being studied. In summary, coping with a variant of unknown significance involves understanding its uncertain nature, avoiding hasty decisions, working closely with your healthcare providers, considering family testing if appropriate, and staying updated on new research. This balanced approach helps ensure your care remains evidence-based and personalized, even when some answers are still on the horizon. Always consult your medical team for advice tailored to your specific situation.